Yeah. Good evening, everyone. I also see Shamlata ma'am. Good evening, ma'am.
Yes, yes, yes. Good evening.
Yeah.
Good evening.
Uh, Prasanta sir has also joined us. So today's case presentation is by Dr. Sandhya Verma, who is presenting a case of hypnotherapeutic intervention in the case of OCD, right? And she
No, no,
used
no. Social
sorry,
anxiety.
social anxiety. I'm so sorry.
Social anxiety.
Social anxiety, and she mixed cognitive drill therapy and hypnotherapy. She used a um, eclectic approach of CDT and hypnotherapy, and it would be a very interesting case for all of us to learn and see. Actually, Dr. Sandhya presented this case in the conference as well, but the duration given for each
Yes.
case presentation was very limited over there. So probably we couldn't have a very detailed discussion. So we thought it would be a good idea if she can present the case in detail, and then we can have a detailed discussion, panel discussion over the same.
Very good. It's a good idea.
Yeah.
And sir, in case we can have a similar thing with other people also, those who presented the paper. It's just a request, sir, because we wanted to hear many things but could not hear over there
Yes.
because of the
And
time constraint.
some of those people who were selected for poster presentation, we
Yes,
can
sir.
invite them to present their case here.
Yes, sir.
Please.
So
Yeah, sure.
sir, I'll start now. Mm,
And
Is
may
my
I please
screen
request
visible?
the participants to put their screens on mute? Yeah. Sandhya ma'am, you may start now.
Okay, I'll start. Okay, with the onset, I'll just first say thanks to Rakesh sir, because under his guidance, we are doing the study, and out of the entire study, I'm presenting one case out of it. And when it comes to this case, there are two new things we did. One was doing a CDT under hypnotic trance, and second thing is we try to use CDT as a life skill. So both the things I'm going to present over here. When it comes to social evaluation anxiety, this is what we, understand there's a marked and persistent fear of secure scrutiny in social and performance situation as per APA. And this is what our understanding is when it comes to this particular case study and the project, is that the persistent anticipatory anxiety of being negatively evaluated and of being exploited, publicly embarrassed by seniors, juniors, and peer in formal and informal setting, and avoidance behavior towards job, social responsibilities, social interaction, and maladaptive safety behavior. Now, when it comes to literature review, we all know that it remains most of the time undiagnosed, and it is a core of major mental health. When it comes to social, those people who have a social anxiety, social anxious people, they are generally labeled as shammer. And because of the anxiety, as they are not able to take new responsibilities, not able to take initiative and all, social anxiety in adolescent is avoidance of giving speech, and which we actually took in this particular study as well. And 27.7% increase in recorded number of suicide between 95 to 2005 with suicide rate of 10% per million. Why I'm reporting suicide over here? Because social anxiety is very much closely correlated with substance abuse and suicide. Now, when it comes to our understanding of continuum of social evaluative anxiety, this population is the person, the case I'm reporting is from a normal population. I mean, she was not a clinical case study. And when it comes to normal social anxiety, it is required for survival. However, when it increases further, it becomes distressing. And in case it remains undiagnosed and untreated, it may convert into fear, and normal population function in between this. Those who pass on to high anxiety, they gradually pass on to fear, and they with this distressing, they become dysfunctional. And the basic behavioral pattern which we have seen, that these people are always silently suffer. And major issue with social anxiety is awareness of this particular mental health condition is very less, and people appear very normal, and people don't understand that they are suffering with some mental health condition. And because of their social anxiety, they procrastinate a lot, and they absent from their place of responsibility wherever they're functioning, and they're labeled as shammer and all this. I have already told you earlier. And these people lack confidence, and they fear any kind of center of attention. And the major important thing, which is this next point, that they blame their failure onto others. They say, because of other people, because the other people don't treat us well, that's why I'm like this. And there are a number of adjustment issues, and they're very hypersensitive for their criticism and evaluation as well. Now, when it comes to CDT, this is the way we have conceptualized fear or anxiety when it comes to social anxiety. It is that there are certain objects, which is as OBSD, where O stands for object of or stimulus of fear. Here in social anxiety, stimuluses are meeting, boss, group meeting, strangers, peer, or any person from opposite gender, or any stranger. And it also has they'll be just very fast in a hasty, instead of taking a pause and explaining their slides. And there are a number of other safety behavior we'll take up later. And they have danger ideation, subconscious danger ideation, where when it comes to social anxiety, major danger ideation is fear of losing image and public embarrassment. When it comes to other phobia and all, which is pertaining to, let's say, fear of snake and all, there'll be fear of death and losing limbs. Now, the two-phase model, we have also conceptualized. It says that at conscious level, individual is aware of all the objects which he is fearing, and he is also aware of various mental representations, especially body-mind reactions, and he knows that he is avoiding it. He knows that he is having a safety behavior as well. And there is another level of the model which says that in subconscious mind, which he is not aware of, is where there are various danger ideation or danger perception. Generally in social anxiety, it is I'll be embarrassed and I'll die is not actually social anxiety. It is for other phobias and all. And I'll become handicapped. Again, it is for other phobias and fears, not for social anxiety. Now, the anxiety cycle, what happens with these people? These people do not allow the anxiety to reach to the peak, because the theory says the moment it reaches to the peak, it has to come down. So before that itself, they go for a safety behavior or avoidance behavior, and then the cycle is not completed, and finally they get stuck into the same, and they keep struggling with it. And this particular model of CDT, it says that through verbal exposures and imagination, experiential exposure and audio exposure, we take the individual to the highest level of anxiety, and automatically it goes down. Now, the another aspect of it is, like, this is what we have conceptualized CDT as. There will be a past experience, and because of the past experience, there'll be a feared cognition that gets activated the moment the person faces or any kind of stimulus pertaining to the fear. And then again, it further activates future brain activation. If you see fear and phobia, all verbalization of fear and phobia is कि मेरे को embarrassment हो जाएगा, मैं blank हो जाऊंगी, मुझे दिखाई नहीं देगा, मैं बोल नहीं पाऊंगी. Everything is future, activated or future oriented. And because of that, there will be a BMR activation, and then an individual either goes into the safety avoidance behavior, safety behavior or avoidance behavior. Okay. Now I'll come to the steps of CDT, how we go about it. The very first step is after the case study and all. First step is we identify past experiences and which cause phobia, and then we give psychoeducation. Psychoeducation involves all the model which I have just discussed in the previous slides. And then step 2, we identify OBSD model, and then we convert danger feature ideation into the past or present. And the most important aspect over here is the ideation is converted into mother tongue of the case or of the individual who has approached us. And the step 3 is it is doing the drill. And drill, when it comes to drill, we have done with this case drill of imagination, putting imagining, and then verbalization, and then audio. And then after that, and we keep doing these 3 steps till the time, keep repeating these steps till the time that fear activation, that stimulus loses its strength of activating the fear. And when the individual feels that he himself reports that now I am strengthened enough and I am now strong enough to face the my stimulus, then we go for a real exposure. And in case during the real exposure, let's say there is any other residual fear or anxiety activation, danger ideation, we again repeat the steps number 2, 3, and 4. This is the way thing keeps happening. Now, when it comes to this particular case study, these are the objectives we have. First objective was we wanted to identify effectiveness of CDT under hypnotic trance for the treatment of panic attack, because this lady came to us was with a panic attack. And we wanted to identify effectiveness of CDT under hypnotic trance for treatment of social anxiety. And we also wanted to identify CDT as a life skill model for managing anticipatory evaluation anxiety when it comes to social situation, that is social evaluative anxiety. Now, when it comes to this case study, this girl was of 28 years of age, and she is into marketing research. As she was in a marketing research, she was into a very high performing job, and she was to face every now and then strangers and meeting people and all. So there was certain event which happened in past with her. Her boss publicly humiliated her in front of the entire team. And since then, her panic attack started, and then she consulted a psychiatrist. And this girl later on was referred to me from the psychiatrist for the panic attack and all. And in the office, she was labeled as shammer, non-performer, though she used to do a lot of work, but still her image was shammer and non-performer. And she would avoid meeting new people. She would avoid speaking in the meeting, even though she know answer, but she will not speak up. And she feels extremely anxiety while giving presentation. This was a major concern for her when we took a case study, because she said, because ma'am, I am not able to give a presentation. That's why I am perceived as a shammer. I am not able to assertively tell about my product to the people. So that's why I'm considered as a, non-performer, and because of that only, she is not able to attain the targets as well. And another thing which she told me, that it was 4 years of her marriage, and she was not able to conceive because of the stress which is going on, and she feels very much stressed. And the family history, when we took, we found out that her father was critical and mother was socially anxious. And the precipitating event which led to the panic attack and all, for which she has come to me, was the abusive boss, and one event, particular recent event, when she was publicly ridiculed for hours in that meeting. And there were a number of other events also with her, which has led to this anxiety. Now, the test which we administered was SAQ, that is Social Anxiety Questionnaire, 30-item questionnaire, DAS, State Self-Esteem Anxiety, and Personal Report of Communication Apprehension. Okay. So, as per the test, this is what the test says, the initial pre-test. The public speaking with authority, it was very high in her. Interaction with the opposite gender, it was moderate. Assertive expression of annoyance, disgust, and displeasure was very high. And criticism, fear of criticism and embarrassment was high. And interaction with stranger was moderate. When it comes to CDT protocol, now how we have gone about this particular case. Initially, we have given her CDT at conscious level because we wanted to train her for the CDT, and after giving CDT at conscious level, she was given CDT in under hypnotic trance. So we have taken 4 sessions of CDT at conscious level. Later on, we have gone for a hypnotic trance, CDT in hypnotic trance. So the protocol of CDT which we followed was assessment of social anxiety and self-esteem and psychoeducation, identification of OBSD model, formulation of drill statement in mother tongue. This girl belonged to Bangalore. So this drill statements were formulated in her language itself, and it was formulated in past. And drill session exposures were first drill session was for imagination when the anxiety level has reduced. Then we have gone for verbal exposure, then for audio exposure. And when it comes to drill session itself, every drill statement exposure was given for 2 minutes. And then after 2 minutes, she was told to report her emotions. And when it comes to emotions, this is a emotion wheel which we used for rating her emotions, and emotions were rated on a scale of emotion and body reaction both. They were rated on scale of 10, 0 to 10. And she was also told to report her body reactions and the thoughts and images and any past experience that pops up into her mind. And then after this, she was told to relax in a 4-8-4 breathing pattern, wherein with the count of 4, she was supposed to take a Ujjayi pranayam, and with the count of 8, she was supposed to breathe out. But when she will breathe out, it'll be breathing out as if she is blowing candle. And this relaxation exercise continued for 2 minutes. After that, daily homework was given to her to do that, and do drill exercise at home. And then she was also told to maintain her negative thoughts, because here we were training the case to become self-reliant, and we are training her CDT as a life skill. So we told her to maintain whatever negative thought comes to your mind, you just note it. And we have also told her to maintain a strength diary. Now, what was there in strength diary? What we have noticed that in CDT, in first session itself, the candidate feels strengthened. Candidate feels that he is now in control of her emotion and her body reactions. And then it has got its own spillover effect when the person faces the environment, the real environment, then the intensity of BMR is reduced. So every day there is something or new thing that happens. So we have told her to maintain a strength diary. This also helped her in building up her self-esteem. And then along with this, when 4 sessions were over, then we have taken her into the hypnotic trance, because by now she has learned CDT. And under hypnotic trance, we have told her, we have applied this CDT. We have told her, we have taken basically the core CDT danger ideation, and core danger ideation with her was, I'll be embarrassed and I will be ridiculed. So we have given, it has got the highest intensity of fear and anxiety. So we have told her to do CDT under hypnotic trance. And in that trance itself, we have told her that after 2 minutes, now you visualize into your emotions. And after that, report your body reactions, do the breathing. And within the session itself, she was told to face the boss in a under hypnotic trance. And then we also did empty chair technique with her for her ego strengthening and forgiveness exercise for the boss and the father and other people, those who with whom she had few incidences of ridicule and public laugh and all. Now, next one, after that, this CDT was over, and CDT and the hypnotic trance were over. She was also given social skill training for maintaining boundaries with the boss and the people, those who are aggressive, and how to be assertive. And then a behavior test was taken. Behavior test is basically real exposure was taken. Then I think after 1 week itself, there was a presentation over there at her office. She was told to face it. And when she came back, then she reported me, ma'am, I didn't feel any issues at all. After that, we have gone for a post-training assessment of social anxiety and public speaking. So this is OBSC structure of this case. Her objects of anxiety were strangers, boss, group meeting, review meeting, appraisal boards where her appraisal was taken, authoritative people, authoritative looking people, anybody who would look assertive and dominant will trigger anxiety in her. Even the review room and date of the review. Review is every every month they used to have a review. So the date itself will be a issue for her. Now, these all were the body reactions. Basically, confusion. She would always feel that her thoughts get jumbled up and she's not able to speak. She can't speak. And she feels that she is not able to grasp the content what bosses say. She feels that she goes totally cognitively numb when she is in front of the boss. And this was somatization she reported. She said that shoulder pain increases as the review day approaches. And whenever she faces the boss, she feels that her legs have become very weak and now she can't stand anymore. And she's not able to go speak at all. And she feels that during the presentation, she will go blank and she will not be able to speak anything. When it comes to speaking fast, sorry, it should come in safety behavior actually. And what she would do is she will speak very fast and she will not stay even for a while. She will just read out the slides. She will not elaborate on them and just she will leave everything. And rest all are these body reaction. Actually, speaking fast should come in safety behavior. Now, other safety behavior she would apply was she would go for is applying leave on the day of meeting or on the day of review, or she will fall sick on that day. And rushing through slide I have already covered. Prompting other, what happens whenever there'll be, let's say, boss would ask any question, she will prompt other people to reply rather than she herself replying on her own. And in case boss will ask her, she will go quiet and entire night, rather her preparation actually starts at least 1 week before, and she stops doing other work. She just does only preparation. And these are the danger ideation she has when it comes to social anxiety themes. Okay. Now, when we finished our case, we divided the danger ideation into the categories. And these are the categories we identified. There were certain persecutory danger ideation. There was certain ideation pertaining to her self-image. There was certain ideation pertaining to public image. And this is a result of, I am just showing her in 3 drills. This is basically first session itself. In first session, how she has reported her emotion. If you see in first drill itself, the anger emotion has reduced. And this thing is, sorry, not reduced, it is level is this. And in third drill itself, the emotion of anger, betrayal, jealousy, judgment, and victimization, surprise, all these 3 emotions has actually drastically dropped. And when it comes to post CDT, when we took her report, okay, just a second please. So we can see she is reporting all positive emotions. I inquired about anxiety as well. She said, "Ki ma'am, no anxiety." So this is something. And the best part with CDT, which I have identified, is that cognitive restructuring happens on its own. We need not to slog for it. As we like Janssens therapy because we need not to slog a lot. It's a lazy therapy and it helps us in doing more session in a day. Okay. Now these are graphs for body reactions. If you can see this hand shaking and shivering and pain in shoulder, it has reduced in third drill itself. And post CDT, we can see the body reactions. There are no body reaction. Initially in first drill it was there, later on it wasn't there. And there was only one body reaction she felt on the day of day. It was wavery body. Okay. Now along with that, we also took GSR and respiration. And this is the graph of GSR and respiration pre and post. I hope it is visible. Okay. Now these are the sessions for hypnotherapy, how we have gone about it. Initial induction was given with relaxation. later on, we, as she was a meditator, we have told her to, after breathing relaxation, we have told her to meditate and go into a deep trance. And deepening was done with Jheel Baba technique of Jansa. And then we did age regression up to the activating event. And that activating event was the event where she was publicly ridiculed for hours in front of the entire team. And she was a senior person, the rest all were the junior one. And then symbolic imagery with the empty chair for forgiveness of boss and the father and other people's, self-preparation, self-parenting for self-love. Green and red basket exercise is, again, this exercise is being given by us to Dr. Jain. And Jain sir used it for OCD patient. But here I have used this for social anxiety, especially for facing toxic people on, very aggressive bosses. And she has reported later after the therapy that, ma'am, after learning this technique, I'm able to handle my boss in a easy way, and I'm able to handle rather more than handling a boss. I'm able to handle my own emotions. And then after that, we did CD session hypnotic trance and recovery focused behavior therapy, which is another therapy given by Jansa, wherein after all these symptoms were over, we told her that once she will come to the conscious state, at that time, she will already be healed. After healing, what kind of behavior she would like to have, or what kind of confidence and what kind of social skills she would like to have, she has to just imagine that and face the boss. And it was for ego strengthening, assertive and boundary setting. And then post hypnotic suggestions was given, and later on trance was terminated. And this is one session we gave for conceiving, especially taking away her stress. In this, what we have done is again trance based on induced for using meditation, then Jheel Baba technique. And over there, she was told to, in Jheel itself, she was told to basically take out her entire stress. And then we have taken her to her God, and over there, we have told her to visualize that she is conceiving a divine light in her body, and she is conceiving through a new and very divine soul is coming to her. And this way, and then session was ended. And it was after 6 months when she visited me, she told me that she has conceived now. And these are the results post session. When it comes to this case study here, in this case, I'm reporting how much she enhanced when it comes to performing in public speaking. And here we can see that it has increased. Earlier, it was up to the average level. Later on, it has gone to, as per PRCA. No, sorry, it is self-esteem. Sorry, her performance self-esteem was earlier at average level. Now it is at high level. And her social esteem, again, it remained the same. And appearance self-esteem, again, remained the same. Now we have also taken her questionnaire, especially for public speaking, and the questionnaire measures her skills for her anxiety for group discussion, public speaking, interpersonal interactions, and meeting. And we can see it has further reduced after the sessions. And when it comes to DAS, depression, again, it has gone from moderate to mild. Anxiety and stress has gone from high to mild. And this is the feedback which the case itself has reported to me. She said that, ma'am, now I am more mindful when it comes to my own thought. I can identify what all are my thoughts. Because of that emotion wheel training, she is now able to even identify her emotions, and she is able to identify her body reactions and control them as well through 484 breathing. Now she can also identify on her the new triggers which we haven't worked on. And she said that, ma'am, I'm now able to respond rather than reacting. Earlier, she used to react. Now she responds. And cognitive restructuring, she says, the moment I do my CDT on my own, the restructuring happens on my own, and then I can work. And she said that now I have learned to manage my own emotions, and now she is able to, the intensity of emotions, every trigger has reduced further. Even the frequency has decreased, and the duration of the emotion, heightened emotion, that has reduced further. and self-esteem it has further enhanced. She said that her focus has shifted from self-management of anxiety to responding to the environment. Earlier, she was always hyper-vigilant to her own body reactions. Now, she's aware of her boundaries, and now she can, exerting her boundaries and maintain her boundaries, and again reaffirm her boundaries. And what she has told me is that now she is able to perform. Boss doesn't scold her so much, and she is now able to maintain a good relationship with the boss. That's it. Thank you.
Thank you, Dr. Sandhya. That was such amazing and detailed presentation.
Thank you.
I'm sure there are many questions that people would want to ask. They can put it in chat box and we'll read it out to them.
Let us remove this presentation. Dr. Sandhya, presentation निकाल दो.
Sandhya, you're mute. You can exit the presentation now.
How? How?
So that
You just have to stop sharing. That's all.
Stop sharing.
stop sharing.
Okay. I don't know why it's not going away. Has it gone now?
ऊपर stop sharing.
मिल गया सर. Yeah.
हाँ. Yes.
सर अभी क्या?
Very nice case, and you have also taken biological parameters along with
Okay.
psychological parameters. Beautiful.
Thank you.
Really
Sir.
very nice case.
It's all because of Jan sir. Under his guidance, I am doing things, sir.
Wonderful. Yes, so now it is open for discussion. If anybody has got any question to Dr. Sandhya or any comments, please. Yes, Nupur.
Yes, sir.
Go
Good
ahead.
evening, everyone.
Good evening.
sir. Sir, it's a nice presentation, and I want to ask, what is the green and red basket exercise?
Okay, I'll elaborate to you. It is that what we say to the candidate. I say candidate because I don't get clinical population. I work with a normal population. That's why I use this word candidate and the people and all. So we say that the first thing which they have to do in case they are facing a toxic boss, so they have to block their perceptions. So I tell them to look down onto the floor, so that they shall not have even a peripheral vision of their boss. Now this is visual you have obstructed. Now you have to obstruct your processing of the information. Audio obviously you can't process, can't stop. So I tell them to imagine that the two baskets they have kept in front of you. The one is a green color basket, another one is a red color basket. Green color basket will have all the content which you need to process, and a red color basket will have all the content which you need not to process. Basically, I have to make the candidate process the information from neocortex rather than emotionally process it logically. So for this, we have created this two basket system, I tell the candidate to now respond to the, we do the role play. And then I play a role of a boss, wherein I keep telling her that आपने कुछ काम नहीं किया है, तुम्हारा sales बिल्कुल नहीं अच्छा हुआ है, you are a duffer and you don't do anything, number of things, blah 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 blah. So 4-5 sentences, whatever I have told her, now she has to put it in a red basket. Now after that, I told next sentence, if I say that now you are supposed to finish this particular report by evening. You haven't done it, though I reminded you. Now, this is the information she is supposed to process. This information she'll put it into the green basket. And once this entire, गुस्सा गस्सी वाला जो बॉस का हो रहा है information, वो सब खत्म हो जाएगा, she'll pick up the green basket only, and she'll go back to her room. Over there, she'll pacify herself first, work on her body-mind reactions, and then she will process on this. This is the training which we have given to her. And role play has been done based on the past events, which all has happened, whatever she has reported. So that way she has now developed it as a skill. So she's now no more scared of toxic bosses.
That's wonderful. Thank you.
Very good. What she would do with the red basket, then it is left there.
It is left, sir. It is left. It is for the gifting god to the boss.
Good.
तो कुछ देना है ना वापस, सारा कुछ लेके थोड़ी आएंगे. But it सर ये वाला जो मैंने देखा है सर, रेड ग्रीन बास्केट, ये बहुत हेल्प कर रहा है लोगों को. जैन सर ने इसको बताया था हमको ओसीडी के लिए, हमने इसको यूज करना शुरू कर दिया सर टॉक्सिक बॉसेस के साथ.
Very good approach. Yes.
Thank you.
शांतनम सर, आपकी कोई कमेंट्स?
Sandhya madam, actually at the outset I want to congratulate you.
Yes, sir.
For your wonderful presentation.
Thank you, sir.
Actually, you have worked out some graph,
Yes, sir.
pre-post, that actually whether you have used any statistics or based on the score you have made that graph.
It is just a raw score. Statistics I haven't done. We are doing it for the sample, but not for this particular case. I haven't done, sir.
Yeah, based on the raw score
Yes, sir.
score of pre and post you have done.
Yes, sir. Yes, sir. On the
That
rating,
graph.
that VAS rating, no, visual analog scale rating, on a
Okay.
scale of 10. It is
Okay,
plotting on that only, sir. Nothing else.
Okay. Yeah, good work, madam. Good work.
Thank you, sir.
Really.
Dr. Sandhya,
Yes.
I have a question for you. So
Yeah.
this red and green basket technique is used after the drill statements, or we can use it at any point? Because I was
Any
wondering
point. Any
at any
point. Yeah,
So
any
what-
point.
So what if a person
Hmm.
comes up, I mean, if a person shows a very strong emotional thing attached with even the red statements, and there is a strong emotional component to it.
Mhm.
So,
Then
you think-
first do CDT. See, it is a technique. Let's say the candidate who has come to me, the lady who has come to me, she was going to the office every day. So the red green basket, I've told her, trained her on a day one itself, along with the CDT, sessions I was doing. So let's say you are getting, basically you all get patients, you don't get normal people. So for them, you can first help them in learning CDT as a technique for managing their emotions. So how I tell my clients is, I tell them before they're being called by the boss, let's say they get a call from the boss, now it's a trigger. That boss wants to see her in her office. So it's a trigger. So I tell her, identify your danger ideations, do CDT there itself, and visualize read in green basket based on the previous responses the boss has told. Boss का एक typical तरीका होता है ना बोलने का कि ये वही गालियां देगा जो पहले देनी है boss को, right? So she has to visualize those things and practice green and red basket before she leaves for the boss's room. And when she will go to the boss room, over there she'll pretend that she is very anxious and niche. She will look down onto the floor. Peripheral vision मेरे को block करना है इसका. And then she just start doing red green basket. Doesn't mean that she does this. She doesn't do that. Just visually she does that. So it really has helped her a lot. And her boss is still toxic.
Thank you.
But this as a CDT here, I would like to report, sir, that CDT in this case, we have identified that CDT has worked very well as a life skill model. And on a bigger population now, we are further doing it. And we are finding that CDT as a life skill, it is really helping us a lot, like helping the candidates and helping us in doing the study in a better way. We can now take a more sample, bigger sample than only 1-2 case studies. And soon maybe we will get into, mass hypnosis of social anxiety. Let's see, CDT. Because there are many danger ideations which are common when it comes to public speaking. common danger ideations are I'll go blank, I'll be embarrassed, I'll be ridiculed and all. So all these common danger ideation can be used during mass hypnosis.
Very good.
Okay. Anybody else would like to comment or ask something?
So there is a question on the chat box that I see by Sonam. Sonam wants to know what were the post-hypnotic suggestions in this particular case. Were there any specific post-hypnotic suggestions?
Yes, the post-hypnotic suggestions were, first, whenever she will go to the boss, she will continue doing green and red basket. She will be able to manage her emotions, reduce it further, and she will perceive herself as a very efficient person. These were the cluster of emotion post-hypnotic trance suggestions. And one suggestion which I gave was ki, whenever she will face a trigger, CDT will automatically start functioning on her mind. It will become part of her life. So this worked. That's why I think CDT as a, we need to yet to see it in other subsequent cases and subsequent studies, that maybe because of this this post-hypnotic trance suggestion, post-hypnotic suggestion, this CDT is now transformed into a life skill model here. And I think as otherwise also, we are still working on it. Let's see, we'll come up with more studies later.
In many more subjects.
Yes, sir. Yes, sir.
Excellent presentation, Dr. Sandhya. This is Dr. Prasanto. And
good evening, sir.
Yeah, good evening. The way you have like assimilated various therapeutic schools along with the neurobiological data, that has been excellent.
Thank you, sir.
My suggestion would be to send it for publication to some good journal, might be the International Journal of Clinical Experimental Hypnosis there also, or today only Dr. Mir Chandani has referred to one journal, Indian Journal of Psychological Medicine. In that journal,
yes, sir.
yeah, so they are having a practical psychotherapy section.
Yes, sir.
Where what you actually did, that aspect can be presented, and they appreciate this kind of thing. So you can consider
Sure, sir, I'll do
publication. Yeah.
Sure. Thank you, sir. I'll do that.
Okay.
राकेश जी, आप कुछ कमेंट करें आपके स्टूडेंट के ऊपर, प्लीज.
Dr. Sandhya is doing excellent work, sir. Yes,
Very.
sir. She has basket containing cases. She extracted only one case and presented here. She is having a rich experience of dealing with social anxiety cases. So many cases she has dealt successfully. And the idea of integrating psychophysiological parameters as objective measurement for validation of subjective reports. What we usually do, we gather subjective reports either through structured psychological tests or informal questions. But the addition of GSR, respiration, thermal, heart rate variability, or any other parameter of biofeedback, it enhances the confidence of the client also.
Yes, sir.
Exactly.
It
That
does.
is very good. That is required. And now we have many more sophisticated investigations available.
Yes, sir.
In advanced kind of institutes, like there can be that what they call as PET scan or that
Yes, sir.
I'm forgetting word actually. But
FMRI,
FMRI.
FMRI.
fMRI,
Yeah, yes, sir.
functional
FMRI, yes,
MRI,
sir.
functional MRI.
Yes,
sir.
sir. Yes,
So
sir.
this kind of investigations can help in
Certainly, sir.
We're
Doctor,
planning, sir.
objective evidence.
So we are planning such studies, maybe subsequent another year I'll be doing it, because at INMAS, which is one of the lab over here in DRDO, sir, we have FMRI there, the latest machine. So once I'll be through with this particular project, I am planning to do one case study over there under FMRI. Let's see. Though I don't know how to, assess FMRI, sir. I don't know anything, but I'll do something. I'll take some doctor along with me.
Yeah, there'll be some experts who know
Yes,
that.
sir. Yes, sir.
That is how we should go ahead in research. Different people specialized in different use of different techniques or tools. We can take help of them. Good.
so congratulations, Dr. Sandhya, for
Thank you, sir. All your guidance, sir.
Mhm.
Sir, ever since I've learned CDT, my confidence level myself has, it has increased. Earlier, I used to run away from patients. Now I say, come to me. I'm no more scared of the patients.
Wonderful.
Yes.
Very good. Okay. So there was only one case today. Anybody want to, because we have some time, I think, ask anything, share anything. 5 minutes hai. Okay. Yes, Dr. Bala, please.
So good evening, everybody. I want to ask Rakesh Jain, sir, whether that cognitive drill therapy we can learn by reading this book, or is there some other way of learning it? And some of the abbreviations Dr. Sandhya used, I didn't understand them. Is there a relation with the cognitive drill therapy, or so some of the abbreviations she was using were some abbreviations during her presentation. That also some of the abbreviations I couldn't catch. So is it in relation with the cognitive drill therapy, or is it something else also? And I want to learn also this cognitive drill therapy.
डॉक्टर संध्या क्या क्वेश्चन है मैं समझ नहीं पाया
Sir, ma'am is asking ki there are few abbreviations which I used. Are they pertaining to CDT या वो कुछ नए थे? I think मैंने
abbreviations
हाँ जी सर BMR यूज किया है, CDT यूज किया है,
BMR danger ideation OBSD model
OBSD model यूज
OBSD, yeah, OBSD, I didn't understand.
अच्छा, that I explained. That is a model of by as per CDT.
And also I wanted to ask whether this CDT we can learn by reading your book, sir. That's what I wanted to ask. Rakesh Jain, sir.
Reading book, I think it is difficult to conceptualize because it's a skill, high-end skill.
Okay, sir.
How to use, how to assess, how to use, how not to use. That practically करके ही सीख पाते हैं मैडम.
Okay, sir.
कितने दिनों का अच्छी तरह से सीखने के लिए कितने दिनों का वर्कशॉप चाहिए सीडीटी?
सर वो तो सीखने में तो इनिशियल जो लर्निंग है वो तो 3 days में हो जाएगी, लेकिन इसका जो पोस्ट सपोर्ट है ना सर, इट कंटिन्यूज.
3 days workshop followed by support.
Continuous support. It needs continuous support, supervision.
We can think of one of the programs by AOH. We can organize this CDT lengthy workshop, full workshop for CDT. If you want 4 days, there can be 4 days also. Somewhere, ये एक करने जैसा है AOH का this year program, ना?
उसको कंसीडर कर सकते हैं सर, कर सकते हैं, उसको कंसीडर कर सकते हैं.
आप आएंगे बड़ौदा? तो बड़ौदा में करते, नहीं तो हम लोग आ जाए वहाँ हरिद्वार में.
एक प्रोग्राम तो सर हरिद्वार में ड्यू है, कुछ भी कराइए। कुछ भी
क्योंकि
करते हैं।
आपको थोड़ा आसान रहेगा इफ इट इज हेल्ड देयर, यू नीड नॉट टू ट्रैवल।
जी सर।
देखिए, बट आई वुड विश दैट वी डू दैट दिस ईयर।
यस सर।
Please. Okay.
Okay,
So,
thank you, sir.
Thank you.
Thank you, thank you.
So thank you, Dr. Sandhya. Thank you all.
sir.
We close it. Thank you, Dr. Jain.
Thank you, sir.
And
Thank you, sir.
Thank you, sir. Thank you very
Thank
much,
you,
sir.
sir.
Thank you.
Thank you, everyone. It was a
Thank you.
wonderful meet today.
Thank you.
Yes.
bye.
Yes, it was very good. Thank you.
you.
Right.
Thank you.